Hello, my dear curious and studious students of surgery. Myself, Dr. Mahesh Chaudhary. I am warm welcoming you in my surgery lecture series. This surgery lecture series contains entire surgery with anesthesia, with radiology, with orthopedic. So stay tuned with us. Let's start our surgery lecture series. Welcome, dear students, in our surgery lecture number 16, that is the diseases of the pancreas. In this lecture, we will learn anatomy and physiology of the pancreas, exocrine and endocrine secretions of pancreas, that is the glucagon and insulin, congenital abnormalities of the pancreas, ectopic pancreas, and fibrocystic diseases of the pancreas. Okay, start with me. The pancreas. Start with the embryology. Pancreas develop in two parts, a dorsal and a ventral part. A dorsal part arises in the second half of the fourth week as a diverticulum from the dorsal wall of the duodenum. This part forms the whole of the neck, body, tail, and a portion of the head of the pancreas. A ventral part arises in the form of diverticulum from the primitive bile duct at the point where it opens into the duodenum, forms the pancreatic duct. Now the anatomy of the pancreas. Soft lobulated yellow pink gland lying transversely, divided into four parts, that is the head, neck, body, and tail. The head is lodged within the curve of the duodenum. The neck is about 2 cm in length and its anterior surface is covered with peritoneum. The body has three surfaces, anterior, posterior, and inferior. The tail is narrow and is contained within the two layers of the linorenal ligaments together with the splenic vessels. Dear students, you are seeing the image of the pancreas. You can see the head, body, neck, and tail. The pancreatic duct, main duct of Wirsung, is situated in the center of the pancreas. The bile duct and the pancreatic duct together pass the obliquely into the wall of the descending part of the duodenum, and they unite to form a short dilated duct named a hepatopancreatic ampulla or the ampulla of bile duct, ampulla of Vater. Physiology of exocrine activity of pancreas. Secretes daily 1500 to 25 ml of colorless, odorless fluid at of pH 8. Secretion is mainly secreted by the centroacinar cells and ductal cells. Bicarbonate secretion is mainly under the influence of secretin of parasympathetic supply. Enzymes are secreted. So there are two separate components in exocrine secretions. Students, you are watching the endocrine secretions of pancreas here, beta cell and delta cells. First component, regulation of this part of pancreatic secretion is mainly performed by secretin, the hormone which is released from the duodenal mucosa. Secretin stimulates the flow of pancreatic juice which contains large amount of bicarbonate. Other component like elaboration and secretions of small volumes of fluid with rich in enzymatic activity. The protein rich fluid of high specific gravity contains the inactive form of the enzymes like trypsin, chymotrypsin, A and B, amylase and lipase, that is the digestive enzymes. Pancreatic juices also contains ribonuclease and deoxyribonuclease. Lipase breaks fat into the glycerol and fatty acids, and amylase degrades starches to disaccharides. The neural secretory effects are mediated by the vagus nerve. Now the image you are watching on your screen are the exocrine and endocrine secretions of the pancreas. Exocrines are acini secretes pancreatic juices. Endocrine secretes of Langerhans secretes insulin and glucagon. Here is a good picture showing all the anatomy and physiology in same image. Next slide. Exocrine secretions of pancreas occurs in four phases, that is the cephalic, gastric, intestinal, and post-sebal phase. First is the cephalic phase. Pancreatic secretions is mediated by vagal stimulations. The sight and smell of food initiates this stage. After seeing the food or the smell of the food initiates this stage, that is the cephalic phase. Second is the gastric phase. Starts when meal reaches the stomach to cause gastric distension, and presence of protein in the stomach causes release of gastrin which stimulates enzyme secretion by the pancreas as well as acid secretion by stomach. Third is the phase is the intestinal phase. Starts when acid enters in the duodenum. It stimulates release of secretin which stimulates pancreatic fluid and bicarbonate secretions. Fourth is post-sebal phase, is characterized by inhibition of the pancreatic secretion, intravenous infusion of glucose or protein hydroxylate, and presence of fat in the distal intestine will inhibit pancreatic secretions. Now endocrine secretions of the pancreas. The internal secretions of pancreas are divided from the islet of Langerhans. These islets are approximately 1 million in number. Individual islet is 100 to 150 in diameter, 100 to 150 nanomillimeter in diameter. These are lead consist of beta cells 75%, alpha cells contributes 20%, delta cells 5% and a small number of PP cells. Alpha cell outermost layer source of glucagon, delta cell intermediate layer of pancreas source of somatostatin and gastrin. Beta cell is the central layer of the pancreas, that is the source of insulin. PP cells, small dark granules, not only present in islets but also scattered in the exocrine pancreas. Secretes polypeptides, vasoactive intestinal peptides, that is the VIP, and gastrointestinal inhibitors peptide, that is the GIP. Tumors of these cells cause WDHA syndrome. We will see this WHA syndrome in our next lectures. Now the image you are seeing on your screen, that is the pancreas of exocrine and endocrine secretions. Exocrine secretion, digestive enzyme secretes through the pancreatic duct into the small intestine, that is the duct of Wirsung, and endocrine secretion, alpha cell glucagon and beta cell insulin secretes into the direct blood. Now the glucagon stimulates hyperglycemia, breakdown of the liver glycogen, consequent release of glucose in circulation, effect on blood sugar, provides release of insulin. Glucagon is also secreted by the intestinal mucosa. Now the insulin, a product by beta cells within the isolate of Langerhans. Granules of beta cells represent the storage form of hormone. An increase in the concentration of sugar will cause an increase in the circulating of the insulin. Hormone secreting also causes the release of the insulin. Stimulation of vagus nerve has to cause insulin release. Insulin promotes the transfer of glucose and other sugars across the cell membranes. Transfers of sugars to muscle cells, fibroblast and adipose tissue requires insulin. The absence of glucose fat is utilized with the resultant ketosis and acidosis. Insulin plays a major role in the conversion of glucose and glycogen in the liver. Now, the congenital abnormalities of the pancreas. These are the first congenital abnormalities of pancreas is annular pancreas. It is a rare congenital abnormalities when two parts of pancreatic tissue, that is the dorsal and ventral parts, encircle the second part of the duodenum due to incomplete rotation of the ventral part of the gland. So, a collar of pancreatic tissue surrounds the duodenum. Clinical features of the annular pancreas are there may be complete atresia of duodenum, abdominal pain, nausea and vomiting. Invitations, there may be double bubble appearance in straight X-ray. For this annular pancreas, treatment is duodenojejunostomy is the most effective way of relieving the obstruction. Duodenostomy is the second option, surgical option in annular pancreas, is sometimes possible in adults and is physiologically ideal. Dear students, you can see here is the abnormalities of the pancreas, annular pancreas, showing the various images on your screen. This is the second image of the abnormalities of the pancreas and ectopic pancreas also. Now the ectopic pancreas. Pancreatic tissue is sometimes found in other organs in abdomen called ectopic pancreas or heterotopic or accessory pancreas. Commonly found in submucosa of the stomach, duodenum, small intestine and mecal diverticulum. Now the next abnormalities of the pancreas is fibrocystic diseases of the pancreas. This is the hereditary congenital abnormalities of all mucous-secreting glands, particularly those of the pancreas and bronchioles. Abnormally viscid mucus is secreted, causes obstruction of the pancreatic ducts and retention of secretion, distension of alveoli and subsequently rupture. Pancreatic enzymes escape and pancreatitis results with subsequent fibrosis. Viscid mucus into the bronchioles causes bronchiolar obstruction, predisposes to respiratory infections. Dear students, this is the image of ectopic pancreas and this second image is the image of the fibrocystic disease of the pancreas. Now the clinical features at birth. Infant, clinical features of fibrocystic disease of the pancreas. Clinical features at birth. Infant is born with meconium intestinal obstruction. It is very rarely. Meconium peritonitis from perforation of the intestine. In infants, respiratory system is more often affected and bronchiolitis develops. There may be bronchiectasis due to the fibrocystic disease of the pancreas. Presence with steatorrhea, pale stool, greasy with bad odor. Infants is cachectic with distended abdomen. In older children, steatorrhea and wasting are the main features. Muscular wasting. Attack of respiratory infection, cirrhosis and portal hypertension is noticed. In adults, main presentation in steatorrhea is steatorrhea and long-standing pulmonary infection. may be bilateral enlargement of submaxillary salivary glands. Excessive loss of salt through sweat is a problem of maintenance of the electrolyte balance of the patient. Now the investigations mainly are based on the chemical test of sweat. Normally contains sodium 70 milliequilibrium per liter, chloride 60 milliequilibrium per liter and potassium 20 milliequilibrium per liter. Trypsin is in the duodenum is often low or even absent. Now the treatment, meconium ileus is there, require operation, otherwise should be treated conservatively. For steatorrhea, decrease fat intake and increase extra protein. Pancreation 5 to 10 gram in tablet pancreatine given before meal to supplement deficiency of pancreatic enzymes in the duodenum. Vitamin D 200 units and vitamin A 10,000 units are given daily. Antibiotics for respiratory infections. Dear students, here is the end of our surgery lectures number 16, that is the disease of the pancreas. Thank you.